I've been at Teen Health Connection for, gosh, almost 20 years. Teen Health Connection started in 1992 out of outreach from the Junior League of Charlotte that was looking at healthcare needs every year, and they decided to focus on the needs of adolescents as an underserved population. In 1992, actually they started meeting a few years before that, and then so we opened in 1992 serving teens age 11 to 22, since we know that so many of their healthcare needs get unmet as well as their mental health needs. So we have always sort of practiced with mental health needs and medical needs and preventive care. So it's sort of been the way that we have practiced for 21 years.
Well, we know the 3 leading causes of death for an adolescent: accidents, homicide, suicide. All 3 of those are preventable ways of dying that we can stop by working together. So we're very fortunate at Teen Health Connection. I'm a psychologist, Dr. Matkins is a pediatrician, and together we provide comprehensive care to meet the needs of our adolescents. Our vision is that every adolescent is empowered to be healthy, safe, and successful. And certainly hope is a very important part of that.
And when we think about hopelessness, and with teenagers, hopelessness often leads to things like high-risk behaviors, teen pregnancy, dropping out of school, making decisions because the consequences or the outcomes are okay if you don't see a sense of future. But in fact, that's what we try not to happen. So that's just part of how we take care of patients.
The hope is that they see a future, right? And that's where empowerment comes in, right? Because we really want them to be empowered to be healthy, safe, and successful. A future.
And we take care of all teenagers, so not all of our teens have mental health needs. We have patients who come in for their yearly physical and a sprained ankle, allergies,
and they're fighting with their mama.
And we ask them about suicide and depression and cutting and eating disorders and spirituality and all those things. But not everybody we see needs those services then or ever. But part of what we do is when we have a patient and we ask them about sexuality is to say that we're open to everything and we're here when and if you need us. And so a lot of teens also tell their friends who come to see us.